In this webinar, we will learn about classification of retinopathy of prematurity and also learn about severe forms of retinopathy of prematurity. The objectives of this webinar are how to classify retinopathy of prematurity and severe forms of ROP and the consequences and complications of ROP. Classification of ROP is done using International Classification of ROP, otherwise called as ICROP. If you look at how to categorize ROP, it is categorized based on the severity of the disease into 5 stages, stages 1, 2, 3, 4 and 5, and depending on the location of the disease into 3 zones, zone 1, 2 and 3, and the presence or absence of plus disease. First of all, let us see how to define the location of retinopathy of prematurity. Zone 1. Zone 1, this is an area or a circle whose radius is twice the distance from the center of the optic disc to the center of the macula or fovea. Actually, any ROP involving this zone 1 could be severe and lead to severe blindness. Zone 2. Zone 2 is a circle whose radius is the distance from the center of the optic disc to the nasal margin of the retina. So, this goes circumferentially round the zone 1. Zone 3, the remainder of the retina from zone 2 to ora serrata on the nasal side and equator on temporal side. This is the crescent area which goes round the zone 2. So, the site of ROP or the location of the ROP would decide whether we are going to deal with a severe form. Once again, I want to reiterate that any ROP involving zone 1 could be very severe and lead to severe visual impairment. For defining the severity of ROP, the following stages are used. Stage 1, in this there is a thin white line of demarcation between the vascular and avascular retina. So, this thin white line separates the vascular retina from the avascular retina. Stage 2, there is addition of depth and width to the demarcation line. That means, it gets formed into a ridge. So, there is progression of the disease from stage 1, which is demarcation, to ridging in stage 2 ROP. In stage 3 ROP, there is more proliferation of the neovascularization or the blood vessels, and so there is presence of extraretinal fibrovascular proliferation of retinal vessels. And stage 4 is these vessels could cause partial retinal detachment beginning at the ridge, not involving the macula in 4A and involving the macula in 4B. So, in other words, partial detachment involving the macula is 4B and not involving the macula is 4A. Stage 5 involves complete retinal detachment. So, to recap, stage 1 starts as line of demarcation and progresses to ridging and then extraretinal fibrovascular proliferation, and then this can cause retinal detachment which could be incomplete, and this if not treated can progress to complete retinal detachment. Next, we will see the severe forms of retinopathy of prematurity, namely plus disease and aggressive posterior ROP. Plus disease is one of the severe forms of ROP, which is characterized by significant level of venous dilatation and arterial tortuosity of the posterior retinal vessels. You would see increased venous dilatation and significant arterial tortuosity in the posterior retina. One important point which should be remembered is that if there is poor pupillary dilatation or rigid pupil, you should suspect plus disease, because it is one of the very important accompanying factor of plus disease. We will move on to the next severe form of ROP, aggressive posterior ROP, AP ROP. It is a rapidly progressing severe form of ROP seen commonly in the smallest and most immature infants with prominence of plus disease. And if you look at the ROP, it will be ill defined, mild appearing and easily overlooked by the inexperienced ophthalmologist. And also there is risk of early retinal detachment in AP-ROP, because this may not progress into stages of ROP from 1 to 3 or 4 or 5. Consequences of ROP or complications of ROP, this can lead to refractory errors, especially high myopia and astigmatism, and squint, and also can lead to amblyopia, unilateral or bilateral blindness and late retinal detachment. The detachment can occur anywhere between 6 months to 31 years, as late as 31 years. So, they need serial examinations for this late retinal detachment, and also they can have glaucoma. Coming to the key messages of this webinar, ROP is classified based on the severity, location and extent of the disease. The presence of plus disease and AP-ROP needs urgent intervention in the form of laser or surgery. Screening and timely intervention will reduce the dire consequences of ROP and prevent visual impairment.